Hello everyone, I just want to briefly go over professional practice models. I won't read every slide to you, but I'll try to hit some of the hot spots on some of these. First off, make sure that you understand the definition between professional practice models and a care delivery model. Later in this, you'll see some examples of care delivery models, but a professional practice model is really a setup. Sometimes it's a picture graphic of how nurses have the ability through committee functions that are outside of the organizational chart, but look kind of like an organizational chart sometimes, that show how an organization ensures through committee structures or functions or groups that nurses have a strong ability to collaborate, communicate, to develop different things, and to ensure that the highest quality of care is given based on getting that kind of feedback. Sometimes they may have a specific theoretical model that they use to kind of show that, but other times it's just kind of a setup in terms of how their system is organized, not by job positions, but organized by committees to ensure that that occurs and that nurses are empowered to participate and have a voice. So again, this lets us know when you have an organization that's using these models that they value nurses in an organization, they support nurses having more control over their practice and being part of a shared governance type model. It does enhance job satisfaction, and studies have shown that organizations that use these models will have much better nurse retention. It has to be supported by management and leadership for it to work, because if your groups of nurses get all these things worked on, built, developed, bring a lot of different ideas or actions forward, and management and leadership is immobile and does nothing with the information, then it kind of becomes just a pictorial depiction on a piece of paper and not a functioning practice model. And it really does work best in agencies where they really have worked on the mission, vision, values, and philosophy and had everything kind of coordinated together in a seamless fashion. I'm going to talk a little bit about these different things in terms of mission, vision, values, and philosophy briefly, but you're going to actually be doing these today, and you're going to get a handout that shows you a little bit of this in turn, kind of walks you through it. Mission statements are really to focus on patient care delivery. The whole goal of it is to inform the public of the organization's key goals, and it really it helps to give you like that backdrop of, well, what's our overall mission? And if we're going to work on that mission, what kinds of goals do we as an agency need to be involved in? So for the leadership, that's great. It kind of helps frame that up for them. But for the employees and for the public, there's been a huge shift to use much shorter kind of catchphrase type mission statements that kind of say it all in a sentence or less, because then people can really use it from a branding standpoint with their publications, with their advertisement, and it also sticks with your employees. And your employees can't remember 4 sentences of a mission statement that even matters to them. But if they know something really short and catchy that says all of what we're about, then that's easier for them to remember and stay focused on during their day-to-day work, and be very well versed in more, this is why I'm here, and this is what we're doing every day. So a vision statement is different than mission because it focuses on a future direction. It's meant to be inspirational or even aspirational. An example would be, we will be the nationally recognized care provider for whatever. Maybe you aren't the nationally recognized care provider for whatever that is right now, but you are striving for that. So if you think about strive, that's a wonderful word when you're thinking about vision statements and how to write them. What do we want to strive for? That we maybe aren't there today, but we want to strive for. And that's the best question to ask yourself in trying to come up as a team with a vision statement. Value statements are pretty easy to come by, but as a diverse group of workers, sometimes we have very different values. So the key thing there is to bring a broad base of employees together to kind of help with working on value statements so that we really are sure we're, covering everything. But these would be typically really clear-cut. We value honesty. So if we value honesty, then you're going to expect honesty in your employees. You're going to expect honest communications between a doctor and their patient. You're going to expect honesty when mistakes are made. So you kind of see like how that one value of honesty gets driven down into lots of other things. So you're going to have multiple value statements. It's always a good idea to probably have less than 10 if you can come up with that, but really get some really important key values that you want to drive how people act in the organization. The philosophy statement is always a little bit more difficult. Often in nursing, when we have a nursing-specific departmental philosophy, it may be based on a theoretical model. Sometimes that makes it a little bit easier to kind of come up with those statements. But you can often just think about it, in an ideal state, we believe what is it that we believe? Kind of at our core beliefs, what do we believe is important? Is the best. And what if we make these things important will help us meet missions and visions for the future. So it is sort of like values, but values are more, I think, more simplistic, whereas philosophy is a little bit more our basic core beliefs. And sometimes people will get those, again, from core beliefs like, think about, well, in nursing we believe in holistic care. That we believe that if we provide holistic care, patients will have wonderful outcomes. So that's a wonderful philosophy statement there. Next, key things that you should see in an organization and when you're developing your own, if you have a mission, vision, values, and philosophy, it's going to flow into all your other documents. That means policies and procedures in your job applications, your job descriptions, employee evaluations, competencies. When you're going to training, you should see a focus on these things. In your clinical protocols and in your quality plans in the organization. So there should be this coherence between all of those so that we're really, in the actual application parts of things, we're actually focusing on all of that again and again and again so that it really becomes a whole part of the organization. Just wanted to mention, you'll see some description in your book about clinical protocols, and they refer to it as structured care methodologies, and it's just ways that nursing care can be structured. Some of these are more like just a set of standards or a set of guidelines that we may or may not follow. An order set might be chosen to be ordered, whereas a protocol itself is already pre-approved to be used as an order under certain circumstances. So reviewing your textbook, sort of the differences, and if y'all have any questions on that, let me know. These practice models you're going to see quite often in magnet organizations. You're also going to see that there's a huge focus on baccalaureate nurses because they know that it improves patient outcomes and decreases mortality in patients. And magnet hospitals also typically aspire to decrease nursing workloads, which we all enjoy. In terms of nursing care delivery models, just to note that in the community you see mostly private duty and case management. Those are the two models that they use to provide care to their patients. In hospitals, you may see anything from functional, team, primary, case management. There are some that's like a modified primary care model, but just kind of review the differences so that you can kind of pick out when would this kind of care delivery be one thing or the other. There are some evolving models of care, and a lot of places are focusing heavily on patient and family-centered care or relationship-based care. And so if those things are in place, you're going to often see a lot of the tenets from the authors of those theoretical models all ingrained through the nursing department documents like we've just discussed. And sometimes they even hire, the author or the theorist or whomever that developed that type of model of care to actually come and help roll it out in their organization. But patient family-centered care, and we've talked about this before, really talks about allowing patients more preference, more autonomy to make decisions, informed decision, them having realistic care options discussed with them, letting them make their own decisions based on their own values versus imposing our own. And then we know that use of this type of care does improve patient satisfaction, which is very important as well. You will see some other future models of care that are coming out, like transitional care models that kind of deal with how does a person transition from inpatient to in the home or whatever other settings they're going to be provided care in. There is a model in community health now called patient-centered medical home, where all of the agencies that are involved in the patient's care are all in a one kind of setting network, and the person easily has access to the different services that they need. And sometimes they may pay, or their insurance may pay for them to, quote, be managed in this medical outpatient home. And it's not a home they live in, it's more like a centralization of services. And we may see more models that develop based on prevention models and things in the future as well. So leadership and management implications, you have to be well versed in some of these different things. You have to be able to put a lot of emphasis on interdisciplinary teams. You have to be able to be open and willing to work with the professional practice models, be aware of different changes in care delivery methods that may be coming up or are meant to be evidence-based. The Affordable Care Act has had implications on different things that are impacting our care. And then the American Organization for Nurse Executives has the guiding principles for the role of the nurse in future care delivery. And so that's a new book that has come out that gives even more guidance for nurse leaders. Hope that helps, guys.